Cluster headache and ways to treat and get rid of it quickly. Cluster headache, also known as cluster migraine, is a type of severe and painful headache that is considered one of the most complex and severe. Cluster headaches are a rare type of headache, estimated to affect between 1 and 2 in every 1,000 people. Cluster headaches are characterized by severe, painful attacks that hit the side of the head and last for short, regular periods, lasting between 15 and 180 minutes. They can occur several times a day for a period ranging from 2 weeks to several months. Cluster headaches may be accompanied by additional symptoms such as red eyes, stuffy nose, and tearing. Fortunately, there are steps and procedures that can be followed to treat and get rid of cluster headaches quickly, based on the advice and recommendations of the best doctors in the world. Correct diagnosis. The first and most important step in treating a cluster headache is getting an accurate diagnosis from a neurologist or headache specialist. A doctor can determine the correct type of headache and prescribe an appropriate treatment plan. Pharmacological treatment. Pharmacological treatment depends on the severity and frequency of headache. A doctor may prescribe nonsteroidal anti-inflammatory drugs, NSAIDs, for mild headaches, while antidepressants or calcium channel blockers, verapamil, may be appropriate for severe cluster headaches. Preventive treatment. In some severe cases, the doctor may recommend preventive treatment to reduce the frequency and severity of attacks. Hormone-suppressing drugs, corticosteroids, and derivatives of itchy positivity are used for this purpose. Surgical treatment. In some rare and advanced cases, doctors may resort to the surgical option to treat cluster headaches. This includes surgical procedures such as vestibular nerve stimulation or facial neurostimulation. Lifestyle changes. Focusing on some lifestyle changes may help reduce the severity and frequency of headaches. Among these changes, avoiding known stimuli that trigger headaches, getting enough sleep, and reducing stress. Quotes about doctors in the same specialty. Dr. Sarah Khalil, neurologist. When dealing with cluster headaches, we must bear in mind that each case is unique, and that an accurate diagnosis is key to developing an effective treatment plan. Dr. John Williams, headache and pain specialist. Cluster headaches can be challenging for both the patient and the clinician, but dedication and patience are the most important tools in helping a patient overcome this painful type of headache. Professor Maria Santos, consultant neurologist. A holistic approach to treatment is crucial when treating cluster headaches, as the symptoms and underlying causes must be addressed to limit its negative impact on the patient's life. Dr. James Parker, vascular surgeon. In cases of advanced cluster headache that do not respond to drug therapy, surgical treatment can be an effective option to improve the patient's quality of life. Dr. Lena Cater, pain and alternative therapist. Management of pain associated with cluster headaches can include alternative treatment techniques such as oxygen therapy, meditation, and relaxation training, which contribute to symptomatic relief and improved tolerance.